Bismillahirrahmanirrahim. So, in this lecture, we will learn about the classification of the wound. There are many types of the wound that we usually witness in our daily routine, like from simple cut happens with a kitchen knife, from simple prick of the needle, from the burn that we witness in our daily routine, and in our elderly we usually see the diabetic ulcers and the pressure ulcers as well. So sometimes the students gets confused how to classify this wound under which category. So in this lecture we will learn about the simplest classification of the wound. To classify the wound we have three basic branches. We usually classify the wound according to the cause, according to duration, according to the depth of the tissue is involved. So the first classification is according to the cause, etiology. If the wound is formed after some surgical process, then we label it as surgical incisions. That the like wound formed after the C-section, wound formed after any or every type of the surgery, and after the surgery, the wound that is formed over that respective area, we usually label it as surgical incision. The wound that is formed after the trauma, we label it as traumatic wound. That wound that is due to burn, we label it simply as burn. The wound that is formed after the radiation process that is a part of chemotherapy, and we usually doctors usually do it, oncologists usually do it in some can for the some cancer treatment. So the radiation also cause radiation dermatitis, and we usually label it as radiation wound. And the wound that is formed in our elderly patient while due to prolonged bedding and due to prolonged bedding, then we label it as a pressure ulcer where the patient does not get move on its own. And in diabetes, the diabetic foot ulcers form, and in some diabetic patient and hyperlipidemia patient and in obese patient, some vascular ulcers are formed in the lower leg, and we label it as venous ulcer, arterial leg ulcers, and neuropathic ulcers that is usually formed in our elderly, obese, and diabetic patient in the lower legs. And atypical wound like pyogenic granuloma and SLE wounds, we label it as atypical wound where there is no proper shape of the wound, and then we label the disease that under the wound category due to which this atypical wound is formed. So according to duration of the wound, if the wound is healed within 6 weeks, then we label it as acute wound. If the wound does not heal within 6 weeks and takes more time to heal, then we label it as a chronic wound. And according to depth of the tissue is involved, if only epidermis is involved, then we label it as superficial wound. And if the only dermis, if epidermis and dermis both are involved, then we label it as deep dermal. And if whole of the skin is involved, then we label it as full thickness wound. So basically this is the simplest classification of the wound. Now I give this with a scenario like our child present to the clinic after the trauma, and the trauma is that he fell into the ground while running over the ground. So the wound that is formed, for example, formed at the right knee, then we label it as a traumatic wound, and in bracket right knee. Okay. Okay, the next scenario, if the child present to the clinic with a linear incision at the right finger, and the mother gives history that he was flying the kites, and the string of the kite immediately placed into the finger, then we will be label it as kite string injury. Kite string injury. Okay. The third scenario, the mother was cooking the food, and suddenly the fire gets blown up and hits to her arm. Then will be labeled it as burn. But if the only the superficial layer of the skin is involved, then will be labeled it as burn, and in bracket superficial. And if the superficial layer of the skin plus epidermis plus dermis both are involved, then we will be label it as burn and in bracket deep dermal. And if whole of the skin is involved, then we will be label it as burn and in bracket full thickness wound. Okay, so like in another scenario, an 70-year-old male who having diabetes, hypertension, and dyslipidemia, and who is bedridden since last 3 years, and there is a wound at at his gluteal area since 10 days and 15 days, then we will be label it as pressure ulcer, and in bracket we will classify it as superficial, deep dermal, and full thickness. And in similarly in diabetic patient, if there is a diabetic wound that is formed over her foot, and then we will know the duration of the wound, like if the because the diabetic foot ulcer usually heal by taking more than 6 weeks, because most probably multi layers of the skin is gets involved in diabetic foot ulcers. So that is the way we classify the wound, and that is the way we write and label the diagnosis of the wound. So this is the whole process of the wound classification. And the most importantly, we need to know about the difference between acute wound and chronic wound. This is the picture of and the scenario happens in any acute wound. Acute wound usually gets healed within a duration of the 6 weeks, and chronic wound takes more than 6 weeks to heal. So that is why my professors usually say that if the wound takes more than 6 weeks to heal, then there is a high chance of hypertrophic scarring over the wound. So, in acute wound, as such, not more tissues are involved, and wound gets healed in a normal healing process. But in chronic wound, number of the layers of the skin and tissues are involved, so it usually takes time and heals with hypertrophic scarring. And characteristics of acute and chronic wound. Acute wound, treatment duration less than a month, no underlying pathology, normal inflammatory stage, usually heals without complication, and there are extracellular proteins and fibers are already present that helps in the wound healing within a month and 6 week duration. But chronic wound takes more than 6 weeks to heal, and due to some underlying pathology, and there is a prolonged inflammatory stage, and there is a high chance of complications as well. And these inflammatory stage and complication lessen the amount of the healthy growth factors and proteins that helps in the wound healing. So this is overall the classification of the wound, and that's all about this. Thank you so much.